They are calling it a rotten tree that needs pruning branch by branch. House Republicans moving forward with efforts to uproot the health care law. The House has voted. When will there be action in the Senate? Republican Senator John Barrasso out of Wyoming is also an orthopedic surgeon. Senator, good morning to you, and welcome back to America's Newsroom. You know what Mitch McConnell said, the Republican out of Kentucky, said there will be a vote. Will there? How's that going to happen?
Well, you know, Harry Reid says this is a wonderful bill. I think it's an awful bill, and the American people deserve to have that vote. The House has done its job and has now sent it to the Senate, and if Harry Reid is so proud of this bill, he shouldn't be afraid to bring it up for a vote in the Senate.
Well, okay, there are a couple points that Republicans have been picking on. I'll put two on the screen for our viewers to get you to react. Number one, this 1099 form that requires businesses that make purchases up to $600 to report to the IRS. There seems to be agreement on both sides that that could be amended. The individual mandate, though, there is no agreement on that, Senator.
Well, in the 1099 form, the Democrats put it in because they said they wanted to raise $19 billion in extra taxes to pay for this huge health care law, which I believe is bad for patients. It's bad for the providers, the nurses, and the doctors who take care of those patients, and it is bad for our taxpayers. You know, we need to make it easier and cheaper to create jobs in this country, and this new whole set of regulations makes it much harder. That's the 1099 form and the expense of doing that. In terms of the individual mandate, you're hearing cries from that all around the country. The Supreme Court is ultimately going to make a decision on that, I believe, in 2 years. I think it's unconstitutional. But that's why I have been working with others, and I'm going to introduce a bill to give states the choice. It's a State Health Care Choice Act to say, let's do in Wyoming what works best for the people of Wyoming, in New York, do what's best for the people there. But don't have this one-size-fits-all approach from Washington telling all Americans what they have to live under.
There is another option here that's being debated. That has to do with flexible spending accounts, where somebody, you know, like maybe you put $2,500 into your account in January and you have that money to spend throughout the year. Now why would that be on the table? You know, why would somebody want that in the bill?
Well, it's been there in the past. People have used these flexible savings accounts. It gives people an opportunity to shop around and look for a cheaper way, a way to keep their health care costs down. They like that, people that have them. But now this health care law makes it a lot harder, even to the point that if you've used some of that to go out and buy some Tylenol or Advil or a cane or an ankle support, if you've twisted your ankle, now you actually have to get a prescription. So that raises the cost of care if you have to go to a doctor to get a prescription for something that you know what's right for you or a member of your family. And now the government says, no, we're smarter than you are. That's how the government's behaving, that you don't know. You need to go to a doctor to find out if you really do need aspirin or Tylenol.
You know,
it's silly.
The commonality in that goes with the last point on our list here, and that's taxes on insurers. And what that flexible spending account does, what the taxes on insurers does, it generates more money, right? I mean, and it generates more money to Washington in order to pay for the bill and to pay for the uninsured. Ultimately, that's the goal here.
Well, there are a lot of gimmicks in this health care law to raise people's taxes and to make it some way to justify all this huge spending that actually is going to start a whole new entitlement program. You know, look at it. They're cutting $500 billion from our seniors on Medicare, not to save Medicare, but to start a whole new entitlement program for someone else. And there was some of the other gimmicks. One is called the Class Act. You know, even the President's own debt commission has said we should absolutely repeal this Class Act because it's a Ponzi scheme. It's something Bernie Madoff would be proud of. It's a way that they collect money early but is going to go bankrupt and essentially bankrupt the country in the long term. So even the President's own debt commission says they ought to get rid of some of the components of this health care law.
We know it's an uphill climb in the Senate. We'll see what happens. John Barrasso, thank you for coming back here.
Thank you, Bill.
All right, Martha.